Um, so probably most of us have been and feel like we're constantly inundated with um, marketing for both Medicare Advantage and prescription drug plans. And one of the things that's important to know is that Medicare regulates, if you will, the marketing and sales calls or sales ads and all of that kind of stuff. Medicare regulates that for Medicare Advantage plans, which are like the HMOs and the PPOs and the DSNPs, and they regulate it for the prescription drug plans. They do not regulate it for the Medicare supplements. Now, where this ends up getting confusing, though, is that many of these, so the company like Humana or like Kaiser or United Healthcare, those big companies, their sales and marketing information and their ads and all that is regulated and has to be pre-approved by Medicare. Where we get into this inundated barrage, if you will, of marketing materials is that they are allowed to contract with these third-party groups. And so these third-party groups are not at all regulated. So they're the ones who put out all of this information that most of the time is accurate, but um, it's very emotionally driven. It's driven to get you to take action. The goal is to basically get you to make a decision that you will in fact sign up for this or that or the other plan. Sometimes, but usually not, those third-party entities are working on behalf of a national company. So they're working on behalf of United Healthcare, or they're working on behalf of Humana. They're not usually in that broker function where they're looking at all of the different plans that are available. They're simply looking at the one that they are contracted with. Another really big come on that they've started to do the last couple of years is that we have a fairly new product called a special needs plan. And there are special needs plans. There are 3 different basic types. To qualify for a special needs plan, you have to be on Medicaid, basically, or you have to be on a Medicare savings program. And the Medicaid program, so if you are living in the community and you just are, living in your own home, you just don't have a lot of income, then they often will promote and encourage you to sign up for what's called a DSNP, which means duals or dual eligible for both Medicare and Medicaid. And then the special needs plans, part of what they also do is then they increase or give you a lot of additional benefits. The second type of a special needs plan is an I-SNP, and that stands for institutional. The majority of the ones that are institutional work in nursing homes, although a few also have contracts in assisted living. And then the third type of special needs plan is a C-SNP, and this is for chronic disease. So you have to be like in renal failure, or you have to have advanced chronic obstructive pulmonary disease or something like that. And it's a really small pool, and it's only eligible to people who have that diagnoses, whatever it is that the company has contracted with Medicare for. So the really big one that I see promoted most of the time is this D-SNP. And to be a D-SNP, they have to offer not only all the benefits that Medicare does, just like a regular HMO, but then they also have to add on these additional benefits like vision or hearing or dental services or transportation or free meals or these cards, these payment cards that you can use to purchase like over the counter items, or you can use it to pay rent or whatever. And so those additional benefits, these third-party administrators, they become a real advertising arm to promote that, and to then make it look very attractive as to why you should or should not purchase one of those D-SNP plans. And a lot of those plans are very good, especially in the initial sort of rollout. And then what often happens is by year 2 or 3, they start pulling back on those benefits. So the marketing, though, just, it's out there, and there, as I say, if it's done by one of those third-party entities, there's no restrictions on it. So that's one of the things to just know about is the companies have restrictions. Medicare is going to approve their messaging, but these third-party entities, they are in the business of creating emotion, creating an opportunity for you to take action, and their intent is to get you to enroll in something. The other thing that those entities do, which is something to be aware of, is that once you call, especially those third-party entities, they have the ability then to share your name and telephone number with whomever they are contracted with. So that's how then you can begin to get a lot of telephone calls, is that you make an inquiry because it says you might be eligible for this food card, or you might be eligible for dental benefits. So you call that third-party vendor to get information, and now all of a sudden your name goes into their contracted HMOs bank of people who are potential enrollees. And then they use that mailing list and that telephone list as a way now to start making telephone calls to you. So under the regular Medicare rules, Medicare brokers, Medicare Advantage plans, and prescription drug plans cannot call you unless you have a contract with them. Currently, you are getting like your prescription drug benefits from WellCare. Then WellCare can contact you, but Aetna can't contact you. United can't contact you. So again, they protect you until you call one of those third-party entities, and then it kind of gets spread out to whomever they're doing business with. So that's one thing to really be aware of. If you are so inclined, if you will, to make an inquiry from a television ad, it might end up getting you a lot of calls and information that you were not interested in. But working with, if you will, known entities is important, an important way to keep that communication directly to you kind of less. If you are receiving phone calls from an agent or a third party entity, if they are in the process of selling you a plan, you have called, you have said, yes, I am interested in enrolling, then there are, whether it's a third party group, whether it's a broker agent that works for multiple companies, or whether it's an exclusive agent that just works for a single company like Kaiser. Any of those entities, if you indicate that you are interested in purchasing either a Medicare Advantage, a D-SNP plan, a prescription drug plan, if you indicate that you are interested in purchasing those, then they have the obligation to tell you that that phone call has to be recorded. And the reason we have gone to recording those phone calls is that a lot of people have felt pressured to sign up for something when they simply thought on their end that they were asking for information, and then there's confusion in the phone call. And so those phone calls all go into a central database. And if you feel, or you have a friend who feels like they signed up for a Medicare Advantage plan, a D-SNP, prescription drug plan that they did not intend to sign up for, then you can file a complaint with the Medicare Centers for Medicare and Medicaid, and then they will go back if you believe that that's when the miscommunication occurred, is at the time when that person was talking to you, either in person or by phone. Then they find that recording, and then they will review that and make a determination as to whether or not they believe that you were unduly influenced, whether they were ignoring your questions, whether they were pretty much only in the business of writing a policy and drawing a commission, if they believe that that was the intent and you were, I'm not going to say necessarily misinformed, but certainly not fully understanding what you were purchasing, then they can give you a special enrollment period. You can disenroll, and then you can re-enroll in something else. Another thing that a lot of us see just constantly feeling barraged by is the television ads or the newspaper ads. And again, advertising has one of two purposes. Advertising is either there for the specific purpose of creating interest, or it's there for the specific purpose of getting you to take action and make a decision. So between December the 8th all the way through September the 30th of any given year, all Medicare advertising has to simply be for information. It's letting you know that this is out there, these programs are out there. If it is for the purpose or the benefit of getting you to take action, to call, to sign up, to enroll, then those types of commercials and that type of advertising happens only from October 1 through December 7th. And that's the only time that they can do advertising that says, we have a zero premium program, call us now for more details. We have a free food card, call us now for details. Those things like I say, are very time limited. Again, the goal is really to protect, if you will, people from being pressured into changing plans frequently, which causes lots of other unintended consequences oftentimes, because doctors change, they have to send you new cards, you don't get the cards in time, you're not getting the quality of care that you and or the federal government wants you to have. So those are kind of the limitations, if you will, on TV ads. If these insurance companies show up, like at the Salute to Seniors in August, they could give you all kinds of information about their company, but they can't give you information about specific plans that they're offering. The exception to this enrollment is if a company has a 5-star rating. So companies, all Medicare Advantage companies are rated by Medicare, and they're rated based on customer service. They're rated on some quality of care indexes, like how many people in their group received like mammographies and flu shots and things like that. They also are rated in terms of your visits, how fast you got to the doctor or got care from their providers, all of those kinds of things. If there are any 5-star companies, then they're allowed to enroll anytime during the year. This year in 2024, the only 5-star we had was Select Health. I have not seen any ratings for 2025, so I don't know if there's any companies that will be able to sell outside of the October 15th through December time period, or advertise their benefits outside of the October 1 through December 7 time period. So that's kind of the essence of what I wanted to share with you. Do you have specific questions or things that you would like to discuss?
This is maybe a little related, but how do the insurance, especially Advantage plans and drug plans, where does their profit come from? I thought that, say, an Advantage plan got a certain amount from Medicare directly. Is that correct? And
Yes,
then they
they
take
do.
care of something like that.
Yes,
Okay.
they do.
But
And there
then
are annual increases in that.
how do
Yes.
drug plans, where does their profit?
Where does
I'm
their
sorry, what?
profit come from? Their profit comes from,
Yeah.
they also get some reimbursement from Medicare. And then the second thing, though, is that their profit comes from so the drug plan usually contracts with somebody called a pharmacy benefit manager, and the pharmacy benefit manager contracts with the pharmaceutical companies. So basically, they get a portion of the monies that the pharmacy benefit manager negotiates with the pharmaceutical companies. So let's say the pharmaceutical company is going to sell some drug to United Healthcare for $100. So the pharmacy benefit manager might say, we're keeping 30% of all the sales for that drug, and then the prescription drug plan gets the 70% of the sales. And a portion of that 70% then that the prescription drug plan gets, they give to the retail pharmacy. So like King Soopers or CVS or whoever, they give a portion of that to the retail pharmacy to dispense the drugs and pay the pharmacists and do all of that kind of thing. So it's a very convoluted, if you will, supply chain.
Thank you. Oh, boy.
And on the Medicare Advantage side, the other thing I was going to mention is that there is a base amount. And then if they have a certain number of people who are like older or have high risk factors, like they've got multiple chronic diseases or something, or they've got a lot of cancer patients or whatever, then they get what's called a risk adjusted payment. So they get a second payment for taking people who are sicker.
Now, the Advantage, it looks like most of the Advantage plans, you know, if you've got regular Medicare and you're paying the $170, $180 a month that typically comes out of your Social Security, it looks like you still are paying that with an Advantage plan. Is that correct?
Oh, yes, you always have to pay your Part B premium.
Okay. All
And
right.
you always have to pay your Part D premium. So when you
Okay.
sign up with a prescription drug plan, there's a premium. You always have to pay that.
Okay.
Now, some of the plans have these zero premiums,
Yeah.
but
Yeah.
that's for the plan side. That's not for the Medicare coverage. Actually, some of the Part D plans have zero premium too. So yeah, they may not have a premium.
Like WellCare, for instance,
Right.
has zero.
Has a zero premium. Yeah.
Yeah.
So they make their money basically on the sale of the drugs.
Okay. Thank you.
Uh-huh. Any other questions? Okay. Well, thank you for joining. And I don't